Welcome back to the Back Pain Solutions podcast with me, Ben James, and as always, my co-host Jacob Steyn. Afternoon, Jacob.
Good afternoon, Ben.
So today we're talking a bit of an intro regarding postpartum health, postpartum back health specifically, of course, and it's certainly a subject that we're going to talk in more detail about again at a later stage. We've done a little bit of content in the past, but we just wanted to kind of revisit and give a brief overview of some of the important things to consider in terms of postpartum back health. Because there's no doubt, Jacob, I think you're the same as me. You'll see patients, female patients, of course, that will come to see us with lower back issues that might be months, might even only be weeks, months, even years down the line
Yeah.
in pregnancy, that they may have had some back pain before that. They may have not had some back pain before first, second child, or the birth of the first, second child. And ultimately, the challenge that I'm seeing, or certainly the discussions I'm having, is there is no postpartum approach to the health of the mother. It's all very much about the baby. Is the baby healthy? Health visits for the baby, and then kind of throwaway questions of, "How are you doing?" "Yeah, I'm doing okay," and off you go. Here's a baby to look after. And I think it's a really important subject because you've had children, I've had children. My wife's had some back pain following that she never had before, and I think it's a topic that's really important for us to kind of again just put out there because it's it's an issue, and no one's getting enough input on this, is my opinion. I don't know what your thoughts are, but it's something that I've seen regularly. And diastasis, long time after um, giving birth. And when we say diastasis, we're talking that separation of the abdominal muscles, which we'll talk about a little bit in a moment. But it's something that's just not being addressed, not being considered. And I think there has to be long term a kind of rehabilitation plan for mothers.
Yes, Ben. I think that a lot of mothers, whether it's like you say, a few months or a couple of years later, just aren't informed well, and they end up looking on YouTube and find videos or read stuff online. And there are different schools of thought on this topic that I've definitely come across. Um, Depending on where you go, you'll get a different set of information. Um, and I've also had mums who said they've been to a specialist and they said, well, there's nothing else to do but to sew it back together, where you get a
Wow.
little mesh plate behind the tissue, and then they fix, if you want to call it, they fix the diastasis, and then there's very little movement left. But
Wow.
I think it's important to know for the listeners that we can distinguish between a functional and a structural diastasis. And for some women, there's going to be a structural diastasis, which might improve a little bit, but may not improve. What we're then looking for is to improve the functional diastasis. And as the word name says it, it's the function of your core that's going to determine how you use that anterior abdominal wall, and how the pressures are going to be distributed when you want to create pressure in the abdominal cavity in order to protect your back, or become strong again and fit again.
Yeah, and of course we've kind of mentioned a lot there the diastasis, so that kind of separation of the abdominal wall anteriorly. But of course, when we're looking at the core postpartum, we also have to give some some focus for the pelvic floor, because you might have someone that is, when we're looking at back pain and back issues, that actually that abdominal wall is quite nicely knitting back together and they're building that core strength. But actually, if the pelvic floor is weak, then that kind of intra abdominal pressure that we want to create for stiffness to brace the spine, to brace the back, particularly then when you're looking at doing exercises such as squats, deadlifts further down the line. If you are that individual, then the pelvic floor is hugely important as well, and we can't underestimate that.
Yeah, and I think you got to take that together with retraining the functional diastasis, and of course, if there's some uncontrolled urination during too much pressure, if you're using the techniques that especially we use, the especially bracing techniques, creating more intra-abdominal pressure, then you have to be careful and you have to really build it up. Sometimes that takes weeks, months, and then sometimes it doesn't get fixed. I have to say that you have, a small percentage of cases where you never really fix the leaking of urine, especially when it comes to skipping rope or running. But in most cases, and it's very individual because um, we'll have one mom recovering after birth very well able to do planks and side planks and things that generally aren't advised at 3 months, for example. We'll have another mom also, very much dependent on body type, body structure, maybe previous health, some other factors as well, that really needs to go through that process of first 3 months, be very gentle with your abdominal wall, gradually introduce things after 3 months. At 6 months, we're going to introduce more, and so we build that up. And like I just said, it's very much dependent on how somebody actually entered their pregnancy, how they were, what kind of condition they had before. So,
Hmm.
um, in some cases, some moms will actually only start building core strength when they're rebuilding their core. It's not something they did before the
Right.
pregnancy.
Yeah, yeah,
So
yeah.
now we've got a problem, and now they want to do something about it. But it's actually the first time that we're now really going to get to do some work with our core. And so these are things not to forget when you work with somebody.
And also, let's not forget that other big percentage of people that have not only not trained before, but don't necessarily intend to train afterwards. So you've got a big percentage of patients that this isn't even a consideration for, and I think that's the key thing for me here. You've got those patients that maybe been trained before, haven't really considered their core, haven't necessarily conditioned themselves or trained for pregnancy, which I think is a separate topic on its own. You know, I talk to patients now. We're not designed to do the work that we do. We need to almost train for work, versus just, well, I sit at a desk all day, that should be fine. Well, no, that's not right. And similarly, the
Yeah,
birthing, pregnancy and giving birth is a significant thing for the body, and so training
yeah,
for it would be helpful. But then there's those patients that, let's say, they've gone through that process and afterwards they don't necessarily plan to train, but there's absolutely no focus on very simple things that maybe we should be promoting for all female individuals to do, whether that's a natural birth, C-section. There's a baseline of you've given birth, and ultimately, whether you've given birth naturally or via C-section, as the baby grows, the abdominal wall will stretch, and those muscles will stretch, and you will get separation. It's diastasis is a thing for everyone that goes through pregnancy because the muscles have to separate. The
yeah,
challenge is when the baby is born, suddenly those muscles are loose. Those the baby's exited, and the muscles are then under a lot of stretch, and so there's a compromising situation from a risk to back health straight away post pregnancy, and you have this baby to suddenly look after. And then we've got that cohort of patients that are a long way down the line, whether it's again weeks, months, years, come in with back pain that probably in many cases, or certainly in some cases, could be attributed to that kind of situation of life in that moment of having that child. And so, I would, as part of this kind of introductory episode, argue that all all ladies that go through that process should have some guidance for the first 6 weeks. Now, okay, like with anyone, there's a choice as to whether you do it or not. But I think that's a big failure, with respect to women's health, because it can have such a significant impact, not just on the back, but on things like urinary incontinence because of weak pelvic floor. And I think that's a sad reality.
yeah. And if we think about what actually happens during pregnancy, um, we are looking at the back muscles taking over the job. As you mentioned, the front
Center
of
of
the
gravity changes.
yeah, center of gravity. So there's more work for the back muscles, but also the fact that you're not able to use the anterior abdominal wall, right? So that falls away. They're not doing so much anymore. In the later stages, they're doing hardly doing anything. And so the back muscles are really, your brain is now really just using your back muscles. And so when you've given birth after that, you have this program that keeps going. So what we want to do is we want to get that program and rewrite it. We want to change the software. So the brain's actually going to now incorporate the anterior abdominal wall, be able to create pressure again in the in the belly, where we can actually use the sides of our core, the front, the pelvic floor, which we didn't use before, at least the last few months.
Hmm. Yeah.
And so that's one thing that's really important. If moms do that, they already have a big benefit in terms of decreasing pressure in the back, getting their back muscles to relax more by just learning again how to use their core properly. And then on top of that, dealing with those who have a need to fix their functional diastasis. And that's what we usually use the baby 3 month supine technique, where we actually get the patient to use their diaphragm, creating pressure in the abdominal cavity. Because if we think about it, what happens during diastasis, um, the problem you're going to see with somebody who actually has that problem after birth is you're going to see something that we call doming, and doming is when the actual the rectus abdominis, the two muscle layers in the front, point forward, and that's because the transverses and obliques on the side aren't actually pulling them flat.
Hmm. Hmm.
That'll only happen if we can properly use our diaphragm. So we need to be able to use the diaphragm, create compression in the abdominal cavity, which then pulls the rectus abdominis, that's the anterior abdominal wall, pulls it flat. And then we're fixing that functional diastasis. That will also help in the beginning stages of healing to have a better outcome if you have diastasis. But after a certain time, that ability to heal will pass. And if you then still have a diastasis, then we can still improve it functionally, but you might still remain with a structural diastasis.
So talk us through that kind of position, that supine position that you were talking through for the benefit of the listeners. So because that's very much kind of an important element in terms of the breathing component to this, in terms of that diaphragm and building that abdominal pressure.
Yeah. So first of all, we want to really start very gently, because we it really it we want to approach it from a point where we're actually getting the person, getting the woman to feel that they have control over what they do with their core. So it's a lying on their back situation. Usually we pull the knees up, so we have the feet on the floor. In cases where we have an extreme hollowing of the lower back, which also happens after pregnancy in some cases,
Yeah,
we'll put the feet on a chair, knees just over or above the hips, in order to flatten out the low back,
sure.
right? So we get a
Uh,
sort of neutral spine, touching the floor with your low back without pushing your low back into the floor. And then from there, we want to create a brace. And that bracing effect, we don't necessarily in the beginning want to do at 100%. We want to do it 20, 30%, pinching the sides of our core, and then actually learn to expand. We're expanding not more than what we already have as a diameter. So we're not pushing the belly out. Only what we're pushing in when we pinch our core on the sides with both hands, just above the pelvic bone, that's getting pushed out. So we create this pressure in a 360-degree angle, so all around the core,
yeah, sure.
right? And that's how we engage the transversus, internal, external oblique, the three muscles on the side. That's going to pull the rectus, the muscle wall in the front, pull it flat. and so we don't get that doming going. And so once we're able to do that, because that's for some people that's going to be a challenge, we want to be able to hold that while breathing for 20, 30 seconds, do it a couple of times. And then once we are able to do that, we're going to raise 1 foot 2 centimeters off a chair or 2 centimeters off the floor and still see if we can maintain that. And so in increments, we build it up until we really have integrity in terms of using the right muscles, being able to brace.
Yeah, and activate that core. So that, and then
Yeah.
would a progression on that be the kind of more classic dead bug type exercise?
Yes. Yeah. It ultimately is a dead bug. Um, I'm talking more about the what we learn in the dynamic neuromuscular stabilization (DNS), but it's the same thing except dead bug. I like to think it's something that we do in the CrossFit gym, and you get all sorts of cues. It's way too rough, and way too not refined enough in
Hmm.
terms of how to really how to do it properly, especially if somebody who comes with an injury or after giving birth. But it's going to be the same progressions. Similarly, eventually just have one leg, extend your knee, hip a little bit away from your body, bring it back, see if you can maintain that position, and the other side. Um, and then maybe from there we go into a barrel roll. So pretending you're hugging a barrel on your back, keeping that brace on, light breathing, not losing the brace, roll from side to side a couple of times.
Okay. Yeah, nice. So then we're really stiffening that core and activating that core, but then adding that extra dynamic
Yeah,
component. And
yeah,
I think it's fair to say, and again, just not going into too much of the detail here in terms of progressive loading and exercises and different exercises, but I think even if everybody post pregnancy post was given that one activity to do, just in terms of understanding the breathing, the importance, activation of the pelvic floor, but also that diaphragmatic breathing and the support it's going to give to the abdominal wall, that could be a game changer for back health, in my opinion. Because I've had a number of patients that 7 years down the line they've got diastasis back pain and they didn't even know it. It's not like it's a knowing
mhm,
thing that they've come in with. This has been part of the examination that we just said, well, let's just explore this. Let's get to get a good baseline of where that core strength is, and that is a fundamental failure for me in terms of, again, in terms of women's health, because we're potentially allowing problems to develop, to occur, just because we're not necessarily imparting that fairly basic information, but so important.
negligence, I would call it as well, because besides the awareness for it, I think some of my patients will go and see people, other professionals, and they just, they'll try things and it doesn't get resolved. So
Yeah,
they almost come to me, they come for something else, and then I have to screen, obviously, how the core functions, and I pick up on it. And when I speak to them about fixing the functional diastasis, they almost look at me like it cannot be done. I've tried that.
yeah, yeah.
And that's what they tell me. And so people think there's no real other way, unfortunately.
Yeah, and that's a shame. And I think
Yeah.
there's so much detail we could go in here with respect to other exercises and things, but it was just a topic and a subject that we thought we should, again, just focus on in terms of an introductory episode, to just as part of what we do, build a bit more awareness about these things. But I think it really useful for anybody that is listening, that knows of somebody, if it's not themselves, that simple breathing exercise that you've outlined there, Jacob, could be a hugely beneficial thing to start pretty quickly after giving birth, and that could have a huge impact on your abdominal health, your core strength, and ultimately your back health. So something really to consider and to look at. And again, if anyone has any questions, as always, feel free to reach out at info@smartstrong.co.uk. But this is definitely a topic that we'll revisit in more detail, maybe even over a couple of episodes. So keep your eyes out for that. But a good little home exercise on the back of the episode today that you can implement from today. So I think, Jacob, an important topic, useful to just revisit in terms of that introductory session, and we'll be back again soon with some more detail on that, no doubt. All right, thanks again. Thanks for listening. We'll be back soon.